Akidat, let's make a start. People keep joining, so we have quite few candidates. So let's make a start, please.
Okay, sure, sir. Hello, everyone. Welcome to the webinar of Hive Medical Academy. And I am Akita Javed, and I'm international medical graduate. Today, I am here to share with you my thoughts as an IMG in the journey of PLAB. But before I begin, I want every one of you to tell me from which part of the world are you guys attending this webinar from. So you guys can comment down in the chat box below that from which part of the world are you attending this webinar from. I'm waiting, and we are also waiting for the other participants to join. So it will take like 1 or 2 minutes before we officially begin. So Fatima Tariq and Samina Sheikh. I know Samina Sheikh. Hello. Nitasha Ishwaq. Can you comment down from which part of the country are you talking about from? Manchester? Pakistan? Samina from Pakistan? Yes. So most of you guys are like from Pakistan, right? So now you guys can relate to me because I am myself an IMG, International Medical Graduate. So now I would like to begin this webinar, and I would like to start with telling you guys my experience as an IMG. What problems do I think I will face when I plan for PLAB journey? So Asma Amir, okay. Now, let me tell you guys, like being a medical graduate, whenever I plan for my PLAB journey, I know that my PLAB journey is going to consist only these 6 steps. One is that I have to be a medical graduate. I have to complete my degree from my university. Second thing is that I have to pass IELTS or OET. And third is that I have to pass PLAB 1, then I have to go for PLAB 2, then I have to get a clinical attachment, then I have to get GMC registration, and then at the end, after all these things, I have to secure a job, which is like, I think so, like my PLAB journey is going to consist all these steps. But problem arises that when I'm a medical graduate, I usually have given the exam of my own country. I never ever have given exam of international exams. So I don't know what exams questions are going to be like, what patterns are they going to be like, what type of questions are going to be there. So I am like, I don't know anything about that. So for that, I need some guidance. So first problem that I face is this thing, that if I'm going to give PLAB 1, I need the right guidance for it. So this one thing is there in my mind. Second is that if I clear PLAB 1, then I have to give PLAB 2, obviously. So my question comes that, okay, I have to give PLAB 2, and for PLAB 2, I have to go to UK, which is like all the way across the seas, and I have to go to UK to give that exam. So if I'm going UK, then who is going to receive me on airport? Who is going to make me get settled there? Who is going to help me to find a center in which I have to give the exam? So these questions come to my mind because many of us don't have anyone in the UK. We all are like new people who are trying to make a future in the UK and who are trying to be someone in our life. So in all these processes, second questions comes in my mind that, okay, I'm going to go for the PLAB 2 journey, but who's going to accompany me? Who's going to help me out? So these questions arise, and then in like after clearing the PLAB 2, what is going to be like how I'm going to get the clinical attachment, who will help me to get a clinical attachment. And then after all the process, even if I get the clinical attachment, what is going to happen, how I'm going to get registered with GMC. So these 4 or 5 basic questions arises in my mind. And as you know, that registration is not easy. Even like in Pakistan, even if you're a medical graduate, your degree takes about 4 to 5 months just to come to your home. PMC registration is also very tough. You don't get that registration easily. You have to go behind those people. You have to struggle a lot to get yourself registered in PMC when you are yourself the country graduate. And now we are talking about GMC, not even PMC. So you have to think like PMC was your home country registration, and GMC is something which is not even your country. And like registration of that is, you need some people to help you out with. So if you think that you are a superhero and you can do all these things by yourself, then I think great, because many of us, I myself don't think myself as a person who can do all these things myself. I need some guidance and I do need some support. And right now, I think in Pakistan, this one more question comes to my mind is the visa registration, because it's not easy to get visa in Pakistan. And those who have someone outside, they know how much struggle they have to go through when they are applying for visa. So when I talked to Hive Medical Academy, they told me that whenever visa and everything problems comes, they will be there, and they will help us out. Because if in visa process, if you have someone as a reference, your visa process gets easy, and you do get the visa in a very short span of time. So I would say that in terms of Hive, my few questions were very well answered by them, and I got satisfied. More than 80% satisfaction I got from Hive Medical Academy. And another question that raised to my mind was from those who are from Pakistan, I think Simab and everyone. Simab, I think for whenever we are trying to think about UK, the one question that comes in our mind is job saturation. In Pakistan, there is a lot of job saturation. We are not able to get a job, and it's very hard for a medical doctor who have cleared their 5-year medical journey and who are not sitting in home, and they're trying to find a job, and it takes an year or two for them to find a suitable job. And then after even finding the suitable job, the amount of money they're being given, the payment is only like 20 or 30,000 or 40 to 50,000, and max it will be 60,000. So it does not fulfill our needs. It's just, the penny is only for the petrol. It's nothing else. It's not for your needs. So it's like you are a medical graduate, and if Pakistan has such a big saturation, so what about UK? Like many of people around us tells us that UK do have saturation, job saturation as well. So this one thing really bothers me. What happens if I do all these things? I clear PLAB 1, PLAB 2, IELTS, OET, and everything, and I get a clinical attachment and everything. So will I be able to get a job or not? And if I do get a job, like I have heard that there is like misconception going on in Pakistan and other part of the world that being a medical graduate, you are just a 5-year medical graduate. You have not done anything. You have not done a house job. You have not done any other specialization. So you're just a freshly newborn child, and newborn childs are not being given any kind of money, and they are not paid for it. And I asked the same question, just like many of us are thinking, like, will trainees be paid? Will they get a job? And even if they get a job, will they be? The job will be secured? Will they be able to work for like a good amount of time and earn the money? So all the questions were answered to me by Hive that yes, not to worry about anything, because Pakistan, I think Pakistan, India, both of these countries are underdeveloped countries, right? So like they are struggling hard to get to the position where they need to be. But UK is a very well developed country. So if we talk about jobs in UK, we talk about exams of UK, everything is to another level. So if you are planning to give PLAB, you have to clear this from thing. Natasha Ishwaq is also from Pakistan. Welcome to the webinar. So that's what I'm saying, Natasha. आपको ये बात बहुत like in Urdu I will say, because many of us are from Pakistan and they will relate to it, कि एक कॉमन क्वेश्चन चलता है सबके दिमाग में कि अब प्लैब का तो सोच रहे ये ना वही हाल जो यहाँ पे पाकिस्तान में हम सबका हो रहा है, वही हाल हम सबका बाहर जाके भी हो. जो जॉब्स हमें अभी नहीं मिल रही पाकिस्तान में, वही जॉब हमें बाहर जाके भी अगर नहीं मिलेंगी तो फिर फर्दर क्या है? बाहर तो हमारा कोई ऐसा नहीं बैठा जिसके पास जाके हम बात कर सकें कि अब तो जॉब नहीं मिल रही, हम लोगों को अपने पास रख लो, खिलाओ पिलाओ, और हम लोग कुछ कर लेंगे आगे, बाद में कुछ कर लेंगे और जॉब्स कर लेंगे. तो वही क्वेश्चन आ जाता है ना कि जॉब सैचुरेशन क्या सच में यूके में है या नहीं. और इस क्वेश्चन का आंसर, लाइक दिस क्वेश्चन कैन ओनली बी आंसर्ड बाय दोज who are like really there and who are like right now residing in that country. So before passing on to Dr. Shakil Malik, few more questions I have in my mind, because myself, GMC registration. GMC registration is also a big process. It takes about 3 to 4 months just for this registration process. Then after that, how I'm going to apply for GMC registration, who's going to help me with the documents, because many of us don't know which centers of Pakistan are eligible for examination and which are being blocked by the GMC. So this list of centers, I don't want to put my money into something which later I get to know is not even registered by GMC, right? So similarly, I think many of us don't know which centers in Pakistan or which centers across the world are registered by GMC. And when it comes to technology, we are very lazy. We don't want to go and Google it. We don't want to just put our hands onto the keypad and we just don't want to get into this all stuff. We just want someone to put it on our plate, tell us that these registration are registered. these places are good to go, and here you can give the exam. Just put your money in this bank account, we will do everything. So because we are too lazy people by nature, and as a medical graduate, we have too much on our plate. We cannot look otherwise. We cannot go and do other stuff along the side of our studies. So I think when I told these all problems to Hive Medical Academy, they told me that all you need to do is sit back, relax, just chill, just do your stuff, what you're doing, just study well, just focus on your examination systems and everything. And all you have to do is study. Rest is upon us. We will tell you when is the date of your examination. We will tell you when which center you have to go and give the examination. We will tell you when after the release of the date of your examination, because I think one more point, आप लोगों का सबको ये होता है कि प्लैब की डेट्स नहीं मिलती. पाकिस्तान में ये बहुत फेमस है कि प्लैब की डेट्स नहीं मिल रही. आपने रजिस्ट्रेशन कर दी, आपने मनी सबमिट कर दिया, आपने सब कुछ कर दी, बट डेट्स नहीं आ रही. वो डेट्स की जो सीट्स होती है ना, वो फिल हो गई हैं. अब आपको नेक्स्ट 3 months बाद अप्लाई करना है, या नेक्स्ट डेट का मतलब आप वेट करें. तो ये बहुत कॉमन चीज होती है कि डेट्स नहीं मिल रही होती. एंड आप जब रेडी होते हो ना एग्जाम देने के लिए, व्हेन यू आर कंप्लीटली रेडी, और आपका होता है यार अब तो एग्जाम देना ही देना है, एंड देन सडनली यू गेट टू नो, ओह it's like 3 months ago, like after 3 months I have to give the exam, then it breaks your heart ki yaar I was ready for it and still I didn't got the date. So these few problems I talked with Hive, and they told me dates are like it's our issue. We will find a good date for you. We will inform you on time. You have to just go give the exam, leave the visa registration and everything. We will do it everything. And for PLAB 2, you just need to come to the country, reach out to us. We will help you with the PLAB 2. Then for the clinical attachment, we will help you out with the clinical attachment as well, and we will make you settle in UK. So I was satisfied that somewhat, okay, my half of the worries are gone. The only big part of my life is now study. And for that, they told me that because Pakistani exams and other international exams and other country exams they're very different. In Pakistan, we have this one-liner system. We just go for these one-liner thing. We don't go into situational questions. And even if we do have those questions, it's only 20 to 30%. But in UK, maximum of the examination questions are situational. Like there will be a situation, there's a correlation. So when I read those questions, I was like, oh my God, this is a 5 to 6 lines question, and I got only like few amount of time to answer those questions. So there are certain tricks and techniques to solve those questions, because 5 minutes are only like for each question you got only 1 minute, right? So it takes about 40 seconds just to read that question and then to answer and like put it in your mind that how I'm going to answer this question is another big problem. So there are certain tricks and techniques that were told to me by Hive, that you just need to look at this part of the question and your problem will be solved like this. So yeah, in my opinion, as an IMG, my maximum questions were answered by Hive. And now the only big question that is right now in Pakistan is job saturation. And second one is, are trainees paid or not? Because we are newborn child, we don't know anything else. So are we going to be paid or not? And the third question is, how are we going to get settled in UK? So I will Hive directed me. So I will like to pass on the mic. Before I pass on the mic, I will like every one of you to write down your question right now in the comment box. If other than all these questions, any other question is in your mind, kindly put that in the chat box below, so that when I pass on the mic to the Hive Medical Academy in charge, I will love him to know all the questions which are in your mind. So Simab and everyone else, you can put down your question as well. Natasha, Ishwaq, any question you have as an IMG, because I know many of you who are attending this webinar are international medical graduates like me. So you can put on your question in the chat box below. And when I pass on the mic to Dr. Shakil, he will answer it, and he will let you guys know like what problems you're facing and how they can be solved. So you can just put down your question in the chat box right now. Or otherwise, if the questions are same as mine and the problems are same as mine, then I will just pass on the mic to Dr. Shakil. And
Thank
don't
you so
worry,
much.
कोई problem की बात नहीं है. सब अपने questions लिखें नीचे, and most like they will help us out. They help me out, and they will help you out. Okay, so I think maximum of you have the same question as me. So now I would like to pass on the mic to Dr. Shakil Malik. Sir, the floor is all yours, and you now take over. And I hope all of your questions get answered by him.
Thank you so much, Akidat. Such a beautiful way you explained everything, the worries, the obstacles, the hurdles, myths, and the concerns of the international medical graduate. So, inshallah, हम इसीलिए यहाँ पे हैं because I think most of the people are from Pakistan, so I will continue in Urdu as well. So, हम यही कहते हैं कि no need to worry. आप अपना ड्रीम जो है उसके लिए एफर्ट करें. Just live with us. You just focus on your studies and we will do everything. मोस्ट इम्पॉर्टेंट जो थिंग है वो अबाउट द ट्रेनिंग कि ट्रेनिंग पेड है नहीं है ट्रेनिंग सिस्टम क्या है. So I'm going to explain about the training system in the UK. I'm going to share my slides, what are the training system in the UK, and then we'll take things from there. So you see my screen?
Yes, we can see your screen.
All right, that's fine. Right, so PLAB journey, totally it takes 9 to 12 months. There's a step one where you have to pass, you should have your degree, then you have the English test, you have a PLAB 1, PLAB 2, and then you start clinical attachment, and then you get the job. The training system in the UK, right, there are two sort of training. One is the foundation program and one is SC training. All the fresh medical graduates, either they are local graduate or from the international medical graduates, they are eligible to apply for the foundation program. Foundation program training is FI1, FI2, 2 years of training program. In foundation year 1, you will have 3 months rotation in different specialties, and again, if you will have 3 months of rotation in second year FY2 as well. These foundation programs just to give you taste of different specialties to exposure. You will get the exposure to different specialties to know what you like. Whether you want to go into medicine, you want to go into surgery, you like ENT, dermatology, and just to learn more about the different specialties and the portfolios of those. During these 2 years of training, you will have two supervisors. One is educational supervisor, clinical supervisor. You have got e-portfolio. You will have some competencies which you will be like CBDs, you will have mini axis, MSF, which you will be completing throughout these 2 years training. So these 2 years training is completely paid. None of your work in the UK in NHS is unpaid. All the training, either this is training program or non-training post, they are fully paid. Once you have completed your foundation program, then you will be eligible to apply for your specialty training program or internal medicine IMT, internal medicine training programs. So specialty training program, there are two types of specialty training program. One is if you want to become a consultant in the UK, and one if you become a primary physician, primary care physician, or GP. For the GP training, you have a GP-ST training program, and you will apply it, and this training is 3 years. And during these 3 years, you have to pass your MRC-GP Part 1 and MRC-GP Part 2. And all this training is, again, it is paid. GP training, out of 3 years, 2 years you will spend in hospital in different specialties, and 1 year will be in the GP surgery and the primary care. Again, you will have one education supervisor, you will have one clinical supervisor, you will have your portfolio, you will go through your revalidation, you will go through your appraisal, and all your work will be completely paid. After 3 years, once you have completed your MRCGP Part 1 AKT and MRCGP Part 2 CSA, then you will complete your CCT, Certificate of Completion of Training, and you will become a GP, registered GP in the UK. If you want to become a consultant in the UK, then you need to apply for the specialty training for the different specialties. Either you want to go into medicine, surgery, orthopedic, whatever specialty of your choice, you need to apply. For medicine, if you're going, this training is 5 to 7 years. During this one, first you will start from the SHO, ST1, then you will become a registrar, then you will become a consultant. And during all these periods, again, you will have two supervisor, educational supervisor, clinical supervisor. You will have your revalidation circle, appraisals every year. You have your competencies. and different sort of specialties you'll be training. Your pay, SHO pay will start from 36,000, and registrar you will be making good amount of money. When you become consultant, it's more than 100,000 plus per year. So this is very simple, straightforward training system. There are no other training post, no other. Different countries, the people say it's PG training. The PG training, same PG training in the UK, it is called a postgraduate training like GPST training or ST training or foundation program. So all international medical graduates, either they are fresh graduates or either they have got experience, 4 year, 5 years of experience, they will be eligible to apply for the SHO post. For all the fresh medical graduates, they are eligible to apply for the foundation training program to start their career in the UK. What if somebody doesn't want to go into training program? अगर कोई ट्रेनिंग प्रोग्राम में नहीं जाना चाहता, उसके लिए यह है कि नॉन ट्रेनिंग पोस्ट होती हैं, SHO की होती है, स्टाफ ग्रेड की होती है, देन लोकम कंसल्टेंट की होती है. सो देर इज, इट्स नॉट दैट यू कांट डू एनीथिंग. कुछ लोग कहते हैं कि हमें जी 5 साल हो गए हैं काम करते हुए, पाकिस्तान में हमने काम किया, अब आगे आके हमें जॉब नहीं मिलेगी, ये नहीं होगा, नहीं होगा. बेसिकली दे डोंट हैव प्रॉपर गाइडेंस, प्रॉपर सपोर्ट. सिर्फ ट्रेनिंग पोस्ट ही नहीं होती हैं, आपके पास लोकम पोस्ट होती हैं, लोकम एजेंसीज होती हैं, आप उनके साथ रजिस्टर होकर एज ए लोकम डॉक्टर काम कर सकते हैं. आई नो सेवरल डॉक्टर्स दे वर्क एज ए लोकम डॉक्टर थ्रू आउट देयर लाइफ. So there is not issue at all about the job saturation or anything, because if you see GMC Workforce Report 2023, there are 52% international medical graduates who are working in NHS. दूसरी बड़ी बात यह है कि PLAB exam, PLAB 2 exam, GMC is taking every day. PLAB 1 4 times a year, but PLAB 2 every day. So there is, you can imagine, there is so much demand of the doctors. There is so much shortage of the doctors in the UK. That's why they have to take exam every day to fill these gaps. Every other hospital, they are short of the doctors. So there is no saturation of the jobs. प्रॉब्लम ये है कि हम इंटरनेशनल मेडिकल ग्रेजुएट जो आते हैं उनके पास प्रॉपर गाइडेंस सपोर्ट नहीं होती है. प्लैब पास करना ठीक है, हो गया प्लैब पास, लेकिन प्लैब पास करने के बाद क्या करना है? पासिंग प्लैब इज जस्ट ए सर्टिफिकेट. द रियल स्ट्रगल विल स्टार्ट टू फाइंड ए जॉब, क्योंकि इंटरनेशनल मेडिकल ग्रेजुएट व्हेन दे कम फॉर द प्लैब 2, आपके पास 6 मंथ्स का वीज़ा होता है. तो आपने ये जो 6 मंथ्स का जर्नी है, इसी तरीके से प्लान करना है कि आप सारी चीज़ें 6 मंथ्स के अंदर अंदर अपनी जॉब सिक्योर करें. आपका CV आउटस्टैंडिंग होना चाहिए, NHS के टेम्पलेट का होना चाहिए, आपकी क्लिनिकल अटैचमेंट होनी चाहिए, आपके गैप रिव्यू होने चाहिए, आपके अकोमोडेशन की वरी ना हो, आपको पता हो कि मैंने जॉब प्रोफाइल कहाँ पे क्रिएट करना है, कौन से हॉस्पिटल में जाना है, इंटरव्यू में मेरे से क्या चीज़ें पूछी जाएंगी, कौन कौन सी चीज़ें पूछी जाएंगी, मैंने मॉक इंटरव्यू कैसे करना है. हम लोग को ये बात समझनी चाहिए कि जब हम जाएंगे वहाँ पे इंटरव्यू के लिए, तो वी आर नॉट competing just with the Pakistani doctors. We'll have doctors from all over the world. So we need to make us stand out. हमारे पास ये सारी चीज़ें नहीं होंगी तो बेशक अगर आपने प्लैब पास कर लिया है, आपको विद इन फ्यू मंथ्स इफ़ यू डिडंट सिक्योर योर जॉब, यू विल एंड अप वेयर, नो वेयर. तो आपको वो सारा जो जर्नी होता है डे 1 से लेके, इट टेक्स ऑलमोस्ट ईयर, तो वो वेस्ट जाता है. नॉट जस्ट द जर्नी, आपके टाइम, मनी, एवरीथिंग. तो वी आर प्राउड टू से कि एट हाइव हमारे साथ जो भी कैंडिडेट होते हैं, हम उनका जर्नी प्रॉपरली प्लान करते हैं. हम 80% प्लैब 2 की प्रिपरेशन उनको वाइल दे आर इन देयर कंट्री हम वहीं से शुरू करा देते हैं, वो ताकि यहाँ पे जब आते हैं 10 डेज अकेडमी में, तो दे हैव अनलिमिटेड टाइम टू प्रैक्टिस इट, पास देयर एग्जाम. जो उनका एग्जाम प्लैब 2 एग्जाम देते हैं, उसके बाद उनके पास 2 वीक्स होते हैं, रिजल्ट का वेट करते हैं. ड्यूरिंग दोज 2 वीक्स वी गेट देम टू डू द क्लिनिकल अटैचमेंट. हमारी ओनली एकेडमी है कि वो गारंटीड क्लिनिकल अटैचमेंट आपको देगी. क्लिनिकल अटैचमेंट के बाद हम आपका CV रिव्यू करेंगे. CV के बाद आपके जॉब प्रोफाइल क्रिएट करना, आपको मॉक इंटरव्यू के लिए प्रिपेयर करना, क्योंकि वही बिलीव के प्लैब तो पास हो गया, उसके बाद हमने जॉब सिक्योर करनी है ताकि हम आगे जा सकें. अगर जॉब सिक्योर न हुई, हमारा वीज़ा स्टेटस चेंज ना हुआ, वी विल एंड अप गोइंग बैक. So all the myths, all those things, we Hive has got a solution for everything. आपके पास कोई भी क्वेश्चन हो, कोई भी चीज़ हो, being myself an international medical graduate and going through this journey, working in NHS for 20 years, I know each step of everything. So any question, anything, we will help you, we will support you. So I would say just contact us. We will help you. We will hold your hand from the day one and take you till you get the job. We have got Dr. Umar with us. He is our co-founder, our academic lead. So he is going to give you the more solution and how we could support you from day one, from PLAB 1. He is going to tell you about the PLAB, what exactly the PLAB. We need to understand the formats of the PLAB and how we will give you solution for every every question and for every your worry, we are here with you. Over to you, Dr. Umar.
Thank you, Dr. Shakil. Thank you, Kidat. Thanks everyone for joining. I love doing these webinars on a Saturday. It's fantastic to connect with people who want to come and live and work in the UK, and that's what we are here for, and that's what we're here to help with. Okay, I'm just going to share my screen, so just give me 1 second, please. Okay. All right. So I'll just start the slideshow. Okay. So is my screen visible to everyone?
Yeah,
And
we
I'm
could see it,
audible?
yeah.
Yes,
Okay,
please.
thank you. Thank you. All right, so very quickly, just before I do start, I also want to say I'm glad that Dr. Shakil and Dr. Aqidat were conversing in Urdu as well. मैं भी उर्दू बोल लेता हूँ. I'm fluent in Urdu as well, so don't be intimidated by the English and the accent. You know, whatever you feels most comfortable for you guys, we can always help, and we'll continue to do that throughout your journey with us. So we'll start first of all with PLAB. What is it exactly? Who is it for? Very, very quickly, these are just basic pieces of information. So it's a licensing exam. It's set by the GMC. It's assessed by the GMC, and it's delivered by the GMC. And it's for anybody who is graduating outside of the UK, and they want to come and work in the UK. Now, there are some exceptions to that, and we'll explain that as we go on. Okay, so how do you know if you need to take PLAB? This is a very busy slide. It looks complicated. I'll just summarize it quickly. Basically, if you are somebody who has graduated, who's got their medical degree from outside of the European Economic Area or Switzerland, then you will need to take PLAB. There's been lots of confusion over the last few months, last year or so, about UKMLA. So I'll touch on that as well, just to explain a little bit. So UKMLA is a new licensing exam, but it's for UK-based medical graduates. So people like myself who went to medical school in the UK, now they have to take the UKMLA before being able to practice in the UK. Now, are these two exams the same? Because we've come across lots of erroneous information being shared by people, academies, other people who are telling people that the exam is the same thing. It's not the same thing. If you are an IMG, if you're an international medical graduate and you are from outside the European Economic Area or Switzerland, then you are still taking an exam which is called the PLAB. If you are a UK-based medical graduate, so you went to medical school in the UK, you will be taking the UKMLA. The only thing that has changed is now that these two exams have the same competencies, and so they align. But currently, IMGs, PLAB, UK graduates, UKMLA, the name for the PLAB may change at some stage, and the GMC said it will do, but not at the moment. So it's still PLAB 1, it's still PLAB 2 for you guys. Okay, I noticed there were questions about IELTS, OET, etc. So hopefully our presentation will answer some of them, and if it doesn't, then you can ask at the end. So the first step is showing your English proficiency, and you can do it either with the IELTS, which is a long-standing international English language test, been around a very long time, and then there's OET, which is more, we feel, and doctors tell us that it's more suited towards healthcare professionals. It's more in line with the kind of language you use in that professional environment, and it seems to be, the doctors tell us, it seems to be slightly easier than IELTS. So we would advise the OET, but either is fine. Obviously, you need to meet particular score criteria on both of them, and you know, when it comes to that stage for you, then obviously we'll tell you more in detail about that. Okay, so the first step is your degree, then showing your English proficiency, and then after that we come on to the PLAB 1 and PLAB 2 exams. So PLAB 1 tests, and this is the key point, and I'm glad Aqidat raised it, in her initial introduction to everybody, is that obviously exams are different wherever you come from. And, you know, this is not in any way disrespectful to where you graduated from, or the kind of the style in which you learned or you were taught. But the exams in the UK, they will be different from the exams that you are used to. So there's much less focus on just purely knowledge, and it's more about application of knowledge. So it's not just how much you can remember. You can remember 150 causes of clubbing, and you can, you know, remember 70 causes of murmurs. It's not about that at all. It's about you using that knowledge to apply it to clinical situations. And that happens in PLAB 1 and PLAB 2. So PLAB 1, it will cover common conditions, important conditions, acute conditions, conditions from primary care. So that's in the community, GP land, and then secondary care, A&E, all of the kind of scenarios you are likely to face as a junior doctor in the UK. PLAB 2 is an OSCE style exam. So PLAB 1 is written, PLAB 2 is an OSCE style exam. Again, all to do with how you apply the knowledge. And it's all about being up to date with the most recent guidelines, with the evidence. And obviously, it's not according to what you learned or practice in your own country. It's all about the UK. So, of course, that means that there is a gap from where you are starting from to where the GMC want you to be. And obviously, that's why we are here, to help you fill that gap. Okay, I'm just going to move the video thing, which is getting in the way for me. Okay, so yeah, PLAB 1, PLAB 2, both obviously exams that you have to take, and both are ones that we can you know, guide you through fully. So we'll speak a little bit about PLAB 1 exam. So it's a multiple choice, actually it's a single best answer question, which is a particular type of multiple choice question exam. 180 questions, 3 hours. So 180 questions, 180 minutes. It is time pressured. And as Aqidat said, you know, she very nicely highlighted the difference that she felt between the questions she's used to doing and the questions that she saw in the PLAB 1 exam. There's a short scenario. It says short. Sometimes it can be quite long. So it can take you a little bit of time to actually read the question. Then you have to understand what the question is asking you. And then you have to, of course, pick the best, the single best answer. So it is time pressured. You do need exam technique. You do need knowledge as well. You do need to be aware of UK guidelines, best practice, all of these things. And obviously on the right-hand side there, I've got a little bit about our PLAB 1 premium package. I won't spend too much on that. You can, too much time on that. You can have a look at that on our website. But what we really want you guys to do is we want you guys to reach out to us, to share your concerns with us, ask your queries, and you know, we'll explain everything for you, as this is what we do for all our candidates throughout the year. The PLAB 2 exam, face-to-face exam, OSCEs, 18 stations, although 2 of them are rest stations. So it's actually 16 scenarios, 8 minutes. You have 90 seconds, so a minute and a half before you enter the station. You have to read the clinical scenario. You have to, during that time, you have to think about what might come when you go into the station. You have to try to remember. You have to try to organize your thoughts. You have to try to mentally prepare yourself to go in and give yourself a bit of a structure in 90 seconds to ensure that you cover all the important parts in this clinical scenario. 3 hours and 10 minutes. So again, another long exam. And you know, this is obviously PLAB 1 is, you know, you're going to need help with as well, but PLAB 2 people will naturally feel more anxious about, because obviously, you know, you're being assessed in a different country. You have to actually travel to a different country. You know, the examiners will be, of course, from the UK system, and so you need to know how how to speak, how to behave, how to converse with the patient. You need to know how to listen well. You need to know how to pick up cues. You need to know how to formulate your thoughts in your mind, and then you need to know how to communicate that information and your clinical the reasoning that you've done in your head, and then you need to be able to explain that, and you need to be able to negotiate with the patient. You might have to calm a patient down. You might have to help a patient kind of through a few minutes if they're upset or angry, or so there's so many challenging scenarios that can come up in PLAB 2, and you need to be coached, and you need to practice, and you need to be told, you need to be observed, you need to be seen how you're doing it, and then you need to be given feedback for how to do it better. This is all our job, and this is all, of course, what we are going to help you with. And on the right hand side of the screen there, we've got a little bit of information about our PLAB 2 premium package, but again, I'm not going to spend too long on these, because you can get all this information from our website, and more importantly, you can get all this information from us when you actually speak to us. Okay, so this slide is not to scare you. I don't mean to put you guys off. It's not to make you guys anxious about the exams, but it's just to let you know that it is although the level of the exam is not very high, so the level is set at so in UJ, Pakistan, India, and other countries abroad, you do your medical degree and then you become a house officer. In the UK, that is an FY1, and then after that, you would then become an SHO. I believe still in some countries you still do house jobs for 2 years. In the UK, you will do it for 1 year. It's called FY1. Then you become FY2. So the level of the exam that PLAB is set at is for somebody who's done FY1, so they've done their house job and they're going into their SHO year or their FY2 year. So it's not a very high level exam in terms of the knowledge that you need or the complexity of the knowledge. But as I said, it's the application of the knowledge. It's understanding what you are supposed to be looking for, how you're supposed to do it, how you're supposed to convey it, how you're supposed to be thinking, all of these things. So because of that, and because of people coming from different healthcare systems, naturally, some people will struggle. And this slide shows you that over the last 5 years, actually until 2023, because we don't have 2024 data yet, that in PLAB 1 and PLAB 2, the pass rate varied between 62% to around 72%. So 20 odd or 30 odd percent of people were failing, and in our opinion, this is because people aren't people aren't getting the right guidance. They aren't being shown the right resources. They don't have everything in one place, and they're getting from here and there, and what can I get from this group, and what can I get from this place, and what can I get from here, and trying to put it all together. Because what you need is something that tells you, here you go, this is what you need to prepare, go ahead and do it. And it's not difficult, because you went through medical school, you've passed medical school exams, you might have done postgraduate exams. So it's not difficult for you to pass in that sense, because you've done it before. You will be able to do it, but you need the right guidance, you need the right resources in one place, and you need people who are experts, who have examined, who have taught, who in these kind of institutions and these kind of organizations, and you need them to help you through that part of the exams. So I'm just very briefly going to just show you a little bit of a taste about what you will get from us when you come and join Hive. So just a brief look at some of the study and exam strategies that we encourage people to put in place to help them. Because like I'm saying, look, we're not telling people that you don't know how to study, or you don't know how to prepare, you don't know how to revise, you don't know how to pass exams. Of course you do. And you're fantastic at it. And that's how you've got to this stage in your studies and your career. But when you are sitting these UK-based exams, you need to change things slightly, and that's where we come in, and that's how we can help you. So you need to, the curriculum is huge. The PLAB 1 curriculum is actually massive. If you go, you can even go on the GMC website, you can download their UKMLA PLAB blueprint. You can have a look at how long it is, the number of conditions that are there. It's massive. So you need to obviously cover all of them. So you need to plan, you need to study, you need to practice with the questions, and then you need to analyze your weak areas and then go back and adjust your plan and then carry on. And you go through that cycle in multiple times in the time you have to prepare. Learning styles are important. Not many people talk about this these days. But you know, the way, and you might still not know what your learning style is, because that might not be something that you are aware of. You might have some kind of idea of actually, I've always read and made notes, or I like visual things or whatever, but learning styles are really important because they help you become more efficient, and they help you to absorb that information much better. So we can help you with your learning style. Knowledge obviously goes without saying, but as I've mentioned, it's the application of the knowledge. And exam technique, so 380 questions, 180 minutes. If you don't have good exam technique, you will struggle. Even simple things like, what is the question asking? You might have 3 or 4 sentences, as Aqidat was saying, and you might have to read it a couple of times before you actually understand what is the question actually asking of me. There's key words in the question, key pointers, things like most likely or least likely, or there might be a negative word like not, which if you read quickly you will miss, and so you will have an opposite understanding of what the question is actually asking of you. So these kind of things, we will help you with, guide you through. Ignoring irrelevant information. There's distractors in the scenarios. There's things that aren't relevant, or they might be relevant to the overall scenario, but they're not going to actually change your answer, or they're not going to affect the correct answer for you in your thinking. So all of these things are what you have to get good at in order to be able to pass the PLAB 1 exam in particular. And of course, PLAB 2 is the same. You're faced with a scenario. You need to absorb the scenario. You need to think through what you're going to do. You need to recall all of the stuff you've practiced and learnt and prepared. And then you have to go in and then be able to adapt as well to the person in front of you who might, the situation might go a completely different way to what you were expecting. And you have to be comfortable with that. And you have to be able to adapt and think on your feet. And this is where practice and regular practice and live observation of your practice with live feedback will help you. Time management is, of course, important. Both exams are very time pressured, and so you need to get better at this, and this is what we're going to help you with. So I'm just going to tell you a little bit about how our solutions can help you with all the problems that Aqidat's mentioned, Dr. Shakil's mentioned. I'm obviously academic lead, so I'm more focused on the exam side of things. But in summary, whether you need somebody to tell you, as I said before, Aqidat was saying as well, we want she was saying we want somebody to tell us, this is what you need to do, this is where you need to put the money, this is where you what form you need to fill in, or we'll even fill the form in for you. If you need someone to present to you a comprehensive roadmap, a comprehensive solution, whether it's just for the exam or whether it's for the whole process, that is what we can do. Or it might be that you don't want to purchase a package, you feel you don't need help with this thing or that thing or that thing, you only need help with one thing or another thing. So whether you need a comprehensive solution or whether you need something customized, which is unique to you, that is what we can help you prepare with. Whether you have a year to do this or whether you only have 1 month to do this, we can help you in both scenarios, and we have done for for many of our students previously. Some of our students who've recently just signed up, they're sitting the February exams, so that's 2 months away, and they only have 2 months. We've had people who only had 1 month, and they said, prepare us for it, and we did it. So whatever situation you're in, whatever is your particular scenario, we're going to help you through it. Our resources cover all the bases. So one of our new candidates asked me yesterday, Dr. Umar, do I need to use anything else? And I said, look, our curriculum, our resources have been fully prepared, and it's fully matched, and it's fully in line with the latest guidance. So you don't need anything else. If you want to use something else, that's up to you, but you don't actually need to do so. We will cover all the bases. And if there's any thing that you feel you need some extra help with, or is missing for you, then we can help you with that as well. I mentioned about learning styles. We've mentioned about, we've touched on the difference between, the UK and other countries. So, if you feel that actually, as the kid that said, things in the UK are different, the questions are asked differently. We tend to be taught differently. I will have been taught differently at medical school to you guys. So, you might not be used to a particular teaching style or a particular learning style. So if you feel actually, I can't do this DIY learning, I can't do the self-study very well, I need somebody to just sit me down and teach me and go through all the topics, like spoon feed me, then if that's what you need, we can do that as well. And we've had people ask us about that before, and we've done that for them also. So what I'm trying to say is, no matter what you feel you need, just ask us and we'll put it together for you. We'll be there for you from the first thoughts you have about moving to the UK and doing the PLAB until you get later on and senior in your career, because we'll always be with you. We'll always be ready to give you career advice and exam advice and advice on anything else you need. Either in the professional or even the personal realm, because that's just the nature of our of the way we deal with our candidates and the way we treat our students. And so we will be there for you throughout your whole journey. I'm just very briefly, just for a few minutes, I am conscious that sometimes I do tend to waffle a little bit. I'm just going to stop my screen share here. I'm just going to give you a little taste of our LMS, which is our learning management system, just to show you what it looks like. And that will give you an idea of what kind of resource you will get if you go for, if you decide to join us, and if you decide to sign up with one of our online packages. So let me just share that screen for you. I hope it hasn't logged me out. If it has, I'll just have to log in. Okay, so guys, Dr. Sheila, okay, can you just confirm that you can see our website? Yeah, okay, perfect. So I'm logged into our profile on our website, so you can explore our website in your own time. It's very it's a beautiful website, fantastic work done by Clixosoft, the guys who put it together for us. So shout out to them. Just going to show you a little bit about our PLAB 1 premium package. So you may have seen this before. There's lots of things included here. There's live teaching sessions, there's tutor support whenever you need, there's a video course, there's 10 mock tests, there's 5,000 updated MCQs, there's an audio course as well if you like, if you don't need the visual side of things, and there's 250 digital flashcards for revision. So there really is everything covered in one place. So I'm just going to go into that now and just show you what it looks like for us. Hopefully my internet connection will be quick enough. So we've got audios, we've got videos, so all the major curriculum areas and specialty areas are all covered here. And if we click on one of them, you will go into the video of that. As you can see, this is 1 hour 20 minutes or 1 hour 20-minute lecture on hematology. It's you'll see there's some strange looking guy speaking to you here about hematology. I'm not sure who this guy is. I've never seen him before. So obviously you can see there's a presentation as well shared for you, so you can look at it, you can take notes, you can pause. and so you're being taught in a lecture style, if that's what you need. The audios are the same, except obviously in the sense that you'll get the same kind of information, but there won't be any video for you to watch. So that's the audios and videos. We then have MCQs. So our MCQ bank is massive. We've got over 5,000 MCQs. You can do these randomly if you want. So if you just feel like doing some practice, it will throw MCQs for you from all kinds of different specialties. Or, as we said, learn, study, practice, analyze. If you found some weak areas, you can go into that and think, oh gosh, my anatomy is weak. And what am I going to do? I'm going to do some practice for my anatomy MCQs. So, this is what it looks like. There's the question. You answer. I'm not going to read the question. I'm just going to pick one thing there, and then you get the explanation as well. And you can, this is for all the different areas of the curriculum. As you can see, there's so many as I'm scrolling up and down on the left side. So, and then we have the mock tests. Now, the mock tests are timed. So it's 180 minutes, 180 questions, and there's 10 of them. That is a lot of mock tests, a lot of preparation. Nobody else offers this many mock tests. And we encourage people to do this towards the end of their preparation, but you can do it at the beginning as well, because it will give you an idea of how much work you need, or how well you're doing at the moment, and how you can adjust things. So if we were to open one of the mock tests, it would take you into a screen, and then the timer will start, and then you will answer 180 questions. And obviously you're not given the answer at the same time, but they will all be there for you. You can see the timer is running now. Your 3 hours have started. I'm not going to read this question. I'm just going to click on something, and there you go. We've gone to the next question. So this is how it will go. And then at the end, when you finish, then you'll get all the answers for you. You'll get all the explanations, and you'll be able to see how you did in the mock test there. Then we come to the flashcards. We've got clinical flashcards. We've got pharmacology flashcards. As you can see, there's lots and lots. There's 250 in total. Let me just pick one and show you one. Which one should we do? Okay, let's do suspected breast cancer referrals. So obviously, as you can see, these are all focused on up-to-date guidelines, very beautifully put together. Again, shout out to Clixosoft. They've done fantastic work in making these look beautiful. So what are the indications for a high suspicion of cancer when somebody's presenting with symptoms suggesting breast cancer? Nice and concise there for you, perfect for revision. Obviously, we cover these in the lectures, but these are here to help you if you need any help in actually revising just at the end. And then we have pharmacology ones as well. So let's pick one here. So the DOACs, which are obviously the newer types of anticoagulants, gives you some examples, indications. What are the contraindications? What are the side effects? What are the monitoring requirements? Are they safe in pregnancy? Are they safe in breastfeeding? Any other notes? So really comprehensive, set of resources which covers all of the curriculum for you. So that was just a quick insight into our LMS. I hope you found that useful. I'm just going to very quickly go back to my presentation screen, and then I'm going to hand back over to Aqidat to tackle some of the questions that have come in, and people can also obviously ask on the mic as well. So let me just get back to my presentation, because I've just got a couple of slides to finish off. These video things tend to get in the way, so they're annoying me a bit. Okay, so we've had a look at the LMS. So very quickly, again, very briefly, I just wanted to say, why are we different to everybody else? There's lots of, companies out there, lots of academies. Everyone's doing fantastic work, but why Hive? So here's a quick summary of why we are different to everyone else. We are the most personal academy you will come across. It's all about you. It's all about your story. It's all about what you need, your requirements. You know, we have set packages, we have set resources, but if that's not, you know, if you need something different, if you need something else filling in, if you need a little bit of adjustment, or you need a totally different preparation, then come to us and we will help you with that. It's about who we are, our stories drive us. Now, we haven't introduced ourselves in this webinar. We felt, look, you know, you can get the information on us from our website and, you know, when you speak to us. But just very briefly, Dr. Shakil, he's an IMG like you guys. He went through the PLAB journey. He's experienced this. He knows all the challenges intimately. He's gone through all of them, and he did it at a time when, you know, there weren't very many people around to support. And Dr. Parvaz, who is our senior ambassador, he's with us as well. He's going to say a few words for you shortly. He did it at a time when there weren't people around as well. So their experiences have been kind of ingrained into the experience you will have with us. Myself, I was, although I'm from Pakistan originally, my family is from Pakistan. I was born and brought up in the UK, and I went through the UK system from the very beginning. So I went through medical school here. I went through foundation year training. I went through specialty training. So I did it, and I've seen it from the other side. I was an examiner. I was a clinical supervisor. I was a trainer. So I, you know, as well as being a senior university lecturer as well. So all of that experience has been put into our academic side, and between Dr. Shakil and us, you know, we cover both sides of the experience, and that results in a rich experience for our candidates. We're always there. You're never going to get the access anywhere else that you will get with Hive. And you can, you know, in order to check on this, you can speak to our current students. You can ask them, you know, they can reach us anytime they need for anything they need help with. We never stand still. We're always improving. We're always updating our courses. We're always trying to be better. We do what others don't. So lots of places will prepare you for the exams, and then they'll say good luck and goodbye. So as I've said to you before, we won't do that. From the first time you have thoughts about PLAB or moving to the UK, we can be with you from then all the way until you have reached the heights of your career and even beyond. And we will fill all the gaps that are there, everything that you need help with, and we will be there throughout the whole journey. And the final thing is we don't compromise on our standards, and that's door to door. So from when you join us, to when you pass through the academy, everything you experience will be world class. And I think I've said enough about what makes us different. I'm going to hand back now to Aqidat and Dr. Shakil. I think maybe Dr. Parvaz is going to say a few things, but I'll let the guys who are chairing deal with that. So thank you for listening, and I'll still be here to answer any questions.
Thank you so much, Dr. Umar, for your insight. And we are very blessed to have you, because I know that you have trained many students, and many students who have gone through PLAB journey have learned many things from you. So it was a pleasure to hear you out, to hear from you, to know your insight on PLAB. And especially the point you told again, because MCQs point you told, you tell us, like you showed us the website, you showed us how MCQs questions are there, how there is an explanation to them. Because many of us, just like me, I think many of us who have joined the webinar know that like MCQs, for MCQs, we usually refer to PLAB 1700 MCQs book, and that MCQ book is the only source of MCQs we have in Pakistan with us to know about PLAB examination system. But like the website you showed me and the explanation downside, I was very impressed by it, because rather than the book was published about 2018, and it's been like years actually. So I think many changes must have come in the examination system, and Hive Medical Academy has website is very up to date. So like I got to know about this MCQ veterans and new MCQs I will get to reach out to. So I'm very happy to know that Hive Medical Academy offers such a great opportunities for students to get interacted to all the latest MCQs. 500,000, I think you have mentioned 5,000 PLAB MCQs, right?
Yes, over
Oh,
5,000. Yeah.
over 5,000. So it's a great opportunity, and you are yourself a teacher, and you know where students do get worried. So thank you so much for your insight. And again, I got satisfied with your explanations and everything. Your presentation was very well performed and done. So now it's time that I invite Hive executive member. He is also the ambassador, senior ambassador of Hive Medical Academy. He is an IMG himself. So I would like to hand over the mic to none other than Dr. Yunus Pervez. Sir, the floor is all yours, and we are waiting to hear you out.
Dr. Faraz, please unmute yourself.
Thank you very much. Very warmly welcome Akidat, Javed, and all of my colleagues.
The pleasure is all.
Do you hear me, please?
Yes, sir.
Hive Medical Academy actually presents not only the solutions in the field of academics, examinations, rather there are a lot of other areas in the life which IMG has to face while passing through these examinations. They might be legal affairs, social issues, financial issues, and they may be residential problems, some transport requirements, and doesn't stop here. Have to face a critical issue of clinical attachment. And lastly, how to fit in this new culture. Whatsoever, the ultimate goal is to bring you in the NHS system to secure your future. And it needs peace of mind, working and enjoying the environment as well. Whenever there is a question of job recruitment during interviews, the mostly asked question is regarding your capability, your commitment, your communication, and ultimately the cultural fitness. And Hive Medical Academy covers all these areas. Whenever you need, whenever you face any issue, any problem, who are non-academic but are related to your exams, just contact Hive Medical Academy. Alhamdulillah, we have a great support for you here to make you happy and successful to secure your jobs in NHS. God bless you.
Thank you so much, sir. It was such a valuable insight, and thank you so much once again.
Let's go through the questions, Akidat. I think a few people they asked questions about. There was one question about PLAB 1 exam. So PLAB 1 exam 4 times a year, February. It is in February, then it's May, August, and November. So PLAB 1 you can take anywhere in the world, 4 times a year. PLAB 2 only in the UK, Manchester, GMC Centre, and that's they take every day.
Sir, can you mention the months in which the PLAB examination system is going to be there?
So PLAB 1 exam 4 times in a year, February, month of February, month of May, month of August, and month of November. So 4 times a year.
So Thank you so much, sir. Samina asked, I'm going to repeat all your questions, Samina, so that after presentation, you will have a clear view on all your questions. So she asked one question, sir, that when we need IELTS for PLAB exam or for GMC registration.
Right. So if you're thinking of the PLAB, you need to start preparing PLAB 1 and your English test together to save your time. So once you have passed your English test, then you can create your GMC account, then you will submit your documents, you will have GMC account, and then only then you can book your PLAB 1 exam. So start preparing
And
for your, yeah, sorry.
sorry, sir. So
Mhm.
she asked this question that which exam is more easier, English proficiency exam, OET or IELTS?
Most of the doctors, they do OET. OET is occupational English test, so it's far easy as compared to IELTS. So I would recommend just try to do OET. And we do OET. We have got at the moment 10 students who are preparing for OET. Our batch is going to end next week. Our next batch is starting from 16th of December. So if she's interested, she could join us OET. And our all the students, doctors previously, they passed their OET in flying colors.
Okay. And how long did you take from PLAB 1 till secure job in NHS? Like amount of time it took?
All right. So total journey will take 9 to 12 months. If she starts today, we will give a schedule. We give her the planner. So everything will be scheduled. We'll discuss with her. We'll make a proper plan. So first we'll start OET and PLAB 1 preparation once she has passed OET. And then we'll get her date for the PLAB 1, done the PLAB 1. Then she'll move to the UK PLAB 2. And after that, clinical attachment. Clinical attachment will prepare for interview, job. So total process will take, if she starts from today, 9 to 12 months.
9 to 12 months. Thank you so much, sir. Samina, Natasha, and everyone else who are in the webinar, if they have any other question, you can put down in the chat box and they will be answered shortly. So if you have any question, you can write it down. Like Sir Shakil answered almost all the questions, but if you still have any question, you can put that in the chat box right now. We are waiting.
There's another
Yeah.
question.
Yeah, somebody asked how after GMC registration, how
Mhm.
much time took for the job. Right, it all depends how well prepared you are. Passing PLAB, as I said before, is just a certificate you have got it, but real struggle will be to secure the job within those 3-4 months. So you need to have your top-notch CV. You should have your interview skills. You should have mock interview. You should have clinical attachment. Should have local references. If you have got all these things and we have guided you, you could get job within 1 to 2 months. But if your CV is not good, you have no local references, no clinical attachment, your interview skills are poor, your communication skills are poor, and you're competing with the local doctors and international doctors, nobody will shortlist you. So there are tips and tricks and proper support and guidance which you need to aware to get the job.
Okay, sir. Thank you so much, sir. Seher, Gulzar, Yasir, Mahmood, Natasha, Ishfaq, Samina, you can tell your questions in Urdu as well. We are ready for it. And if you want, we can unmute you. Just ask your question frankly. This is a chance for you to ask all your queries in one go. So if you have any question, we are ready to answer them all.
Yeah,
Thank
it is
you,
16th
Natasha.
of December. 16th of December we are starting, so registration is open. So just contact us. What we will do, we will start preparing you for OET and PLAB 1 together to save your time. So once you are passing our OET, at least your half of PLAB preparation will be ready and we'll just focus on, like if you're starting now, we should aim your PLAB 1 exam either in February or in May. May probably, we should be target your May, your PLAB 1 and August, your PLAB 2 and September you should start job in the UK. This is how you should plan it.
Okay. And one thing I would like to add on, Hive Medical Academy is available 24/7 because I myself have asked question at times and it is never ever that the answers got delayed. They are always on time and they are available 24/7. So you can contact anytime. And there's one more question from Samina Sheikh, sir. When we need a clinical attachment after GMC registration?
No, usually what we do, we suggest that once you have taken your PLAB 2, you have got 2 weeks. It will take 2 weeks for the GMC to announce the results. So those 2 weeks, we will arrange your clinical attachment. We will prepare you for your interview. We'll prepare your CV. We'll get you your CPD courses done. So after 2 weeks, when you get your PLAB 2 results, you'll apply for the GMC registration. GMC registration you will get in 24 to 48 hours, so you should be ready to apply for the job. So you are not wasting any single day or any single minute, because your visa time will be very short. So we need to organize very properly. So get your PLAB exam done, clinical attachment, your CV, your job profile, everything is ready. The day you get GMC registration, start applying for the jobs and appear interview, you'll get the job.
And don't worry, Samina, when Hive is by your side, you don't need to worry about clinical attachment or GMC registration. They are here to help us and they will guide us through the path. So
Your
any
epic
more questions?
epic verification, your GMC registration guidance, your visa application, pick up from the airport, give you the local SIM, your accommodation. We will do everything for you so that you
Yes,
could
sir.
focus on studies only.
Yes. Any more questions? Samina, are you satisfied or you have any other question left? Natasha, any more questions? Okay. So I think, sir, all the questions are answered. And thank you so much, everyone, for joining the webinar. Okay, there is one more question from Ikra Abid. Can a doctor get handsome package after getting first job?
What do you mean by a handsome package? Doctors, they're already making good money. Like when you start, and I don't know what's included in your handsome package. It's just a job. You know, if you're a fresh doctor, you will apply for the foundation program. Foundation program, they will starting pay is 36,000. But if you want to do some extra hours, like you are free over the weekends, you will get 50, 60 pound per hour. But when you become a registrar, you 70, 80 pound. When your consultant is 100 to 100 pound per hour. So I think this is very handsome package doing. So it is good.
Yes, because I think in Pakistan we are paid monthly. At the end of the month, we are given a specific amount of money. But when you are working in UK, you get paid hourly. Like there is not something which you are calculating at the end of the month that this is going to be your pay. You are going to get paid hourly. After every hour, there is going to be 80 pounds, and everything will be calculated in this way. So I can say that you will surely get a handsome package, and you don't need to worry about money. Just try to prepare, and
Excuse me.
inshallah you will excel.
Handsome means actually how many
Good.
million pounds?
Yes, yes, sir.
So guys, I could see that you really like the webinar. I would say please go on our website and go us, please give us the review. There's a Trustpilot review as well, and there's a Google review. So if you really like the webinar, you want to hear more from us, please give us the review. And our next webinar is on 21st of December, Saturday, same time. We'll be discussing more things. And remember, we are here to facilitate your journey, to make your journey very pleasant and smooth. We also really appreciate all the efforts by the Hive team, Clixosoft. Asma is there. Asma, really thank you so much. Fatma is our executive member. She is, and Huda, she is our executive member. And especially Akidat. Akidat is our executive member, Central Asian countries ambassador as well. And she is international medical graduate, and she represents all international medical graduates to support and facilitate them.
Thank you, sir. Sir, at
Uh,
last, one more question,
Yeah.
then I think we will end the webinar. What about MRCP? Do you help for MRCP preparation?
we
There's
don't.
also a follow-up as well. Would the
Yeah.
MRCP be better or the PLAB exam? So they're both linked.
All right. So we don't at the moment MRCP exam. We don't do the preparatory courses. MRCP or PLAB one. See, PLAB is easiest, cheapest way. Get into the system and complete training while you're working and making money as well. If you're sitting in your country and preparing for the PLAB, you'll be spending money and you'll be nowhere. But if you pass your PLAB exam, it's just 9 to 12 months and you'll be working, and then NHS will prepare you for MRCP. Get into training system, you'll be consultant 5 to 7 years. So always choose the better and cheapest and easiest. Like if it takes you 2 years to pass your PLAB MRCP 1 and you're in your country. So if you're working in the system 2 years, you could make more than 200,000. So think practically, do your PLAB. Whatever you'll invest in your PLAB exam, you'll earn back within a couple of months. So after that, you can do MRCP, you can do orthopedic, whatever you want to do it, MRCP, psych, ops and gynae, you have multiple options.
Okay, sir. Thank you so much, sir. So, before I close the webinar, I think it's the closing time, right? We have
That's it,
exceeded
yeah.
the time. Yes. So I would like to thank all the webinar, all the Hive team who have joined the webinar and who have supported us throughout the way. And I would like to announce this thing that our next webinar is going to be on 21st December, 11 a.m. UK time. So you guys, if you guys still got questions and you want to directly interact with us, you guys can again join on Saturday on 11 a.m. time, UK timing, and on 21st December. And we will be very happy to have you with us in the webinar. So thank you so much for joining, and always remember, where there is a will, there is a way. If you guys have the will to qualify for the PLAB examination, you will, inshallah. So thank you so much everyone for joining. Thank you, Dr. Shakil Malik. Thank you, Dr. Umar. Thank you so much, Dr. Yunus Pervez. Thank you, Huda. Thank you, Fatma. Thank you so much, everyone. Thank you so much. Allah